everyone, it's Jennifer, and I'm continuing on with my series about the eyes. And today we're going to talk about cataracts. A cataract is a cloudy or opaque area in the normally clear lens of the eye. Depending upon its size and location, it can interfere with normal vision. Most cataracts develop in people over the age of 55, but they occasionally occur in infants and young children, or as a result of trauma or medications. Usually cataracts develop in both eyes, but one may be worse than the other. The lens is located inside the eye, right behind the iris, the colored part of the eye. Normally the lens focuses light on the retina, which sends the image through the optic nerve to the brain. However, if the lens is clouded by a cataract, light is scattered so the lens can no longer focus it properly, causing vision problems. The lens is made up mostly of proteins and water. The clouding of the lens occurs due to changes in the proteins in lens fibers. Now, there are types of cataracts. The lens is composed of layers like an onion. The outermost is the capsule. The layer inside the capsule is the cortex, and the innermost layer is the nucleus. A cataract may develop in any one of these areas. Cataracts are named for their location on the lens. 1. A nuclear cataract is located in the center of the lens. The nucleus tends to darken with age, changing from clear to yellow and sometimes brown. 2. A cortical cataract affects the layer of the lens surrounding the nucleus. The cataract looks like a wedge or a spoke. And 3. Posterior capsular cataract is found in the back outer layer of the lens. This time often develops more rapidly. Causes and risk factors. Most cataracts are due to age-related changes in the lens of the eye that cause it to become cloudy or opaque. However, other factors can contribute to cataract development, including diabetes mellitus. People with diabetes are at a higher risk. Drugs. Certain medications are associated with cataract development, and these include corticosteroids, chlorpromazine, and other phenothiazine-related medications. Ultraviolet radiation studies show an increased chance of cataract formation with unprotected exposure to UV radiation. Smoking. There is a possibility, an association between smoking and lens cloudiness. Alcohol. Several studies show increased cataract formation in patients with higher alcohol consumption compared with people who have a lower or no alcohol consumption. Nutrition deficiency. Although the results are inconclusive, studies suggest an association between cataract formation and low levels of antioxidants, for example, vitamin C, vitamin E, and carotenoids. Further studies may show that antioxidants can help decrease cataract development. A family history. If a close relative has had cataracts, there is a high chance of developing a cataract. Rarely cataracts are present at birth or develop shortly thereafter. They may be inherited or developed due to an infection such as rubella in the mother during pregnancy. A cataract may also develop following an eye injury or surgery for another eye problem such as glaucoma. Symptoms. Cataracts generally form slowly. Signs and symptoms of a cataract may include blurred or hazy vision, reduced intensity of colors, decreased sensitivity to glare from lights, particularly when driving at night, increased difficulty seeing at night, change in the eye's refractive error or eyeglass prescription. Diagnose. Cataracts are diagnosed through a comprehensive eye exam. The exam may include patient history to determine if vision difficulties are limiting daily activities and other general health concerns affecting vision. Visual acuity measurement to determine what extent a cataract may be limiting clear distance and near vision. Refraction to determine the need for changes in an eyeglass or contact lens prescription. Evaluation of the lens under high magnification and illumination to determine the extent and location of any cataracts. Evaluation of the retina of the eye through the dilated pupil. Measurement of pressure within the eye. Supplemental testing for color vision and glare sensitivity. Further testing may be needed to determine how much the cataract is affecting vision and to evaluate whether other eye diseases may limit vision following cataract surgery. Using the information from these tests, your doctor of optometry can determine if you have cataracts and advise you on your treatment options. And now we go on to treatment. Cataract treatment is based on the level of visual impairment they cause. If a cataract minimally affects vision or not at all, no treatment may be needed. Patients may be advised to monitor for increased visual symptoms and follow a regular checkup schedule. In some cases, changing the eyeglass prescription may provide temporary vision improvement. In addition, anti-glare coatings on eyeglass lenses can help reduce glare for night driving. Increasing the amount of light used when reading may be beneficial. Oops. When a cataract progresses to the point that it affects a person's ability to do normal everyday tasks, surgery may be needed. Cataract surgery involves removing the lens of the eye and replacing it with an artificial lens. The artificial lens requires no care and can significantly improve vision. Some artificial lenses have the natural focusing ability of a young, healthy lens. Once a cataract is removed, it cannot grow back. Two approaches to cataract surgery are generally used. The first, small incision cataract surgery, involves making an incision to the side of the cornea, the clear outer covering of the eye, and inserting a tiny probe into the eye. The probe emits ultrasound waves that soften and break up the lens so it can be sucked out. This process is called phacoemulsification, or phacoemulsification. The second is extracapsular surgery. Requires a somewhat larger incision in the cornea so that the lens core can be removed in one piece. The natural lens is replaced by a clear plastic lens called an intraocular lens. When implanting an intraocular lens, it's not possible because of other eye problems. Contact lenses and in some cases eyeglasses may be an option for visual impairment correction. As with any surgery, cataract surgery has risks from infection and bleeding. Cataract surgery also slightly increases the risk of retinal detachment. It is important to discuss the benefit and risk of cataract surgery with your eye care providers. Other eye conditions may increase the need for cataract surgery or prevent a person from being a cataract surgery candidate. Cataract surgery is one of the safest, most effective types of surgery performed in the United States today. Approximately 90% of cataract surgery patients report better vision following surgery. Prevention. There is no treatment to prevent or slow cataract progression. In age-related cataract, changes in vision can be very gradual. Some people may not initially recognize the visual changes. However, as cataracts worsen, vision symptoms increase. While there is no clinically proven approach to preventing cataracts, simple preventative strategies include reducing exposure to sunlight through UV blocking lenses, increasing antioxidant vitamin consumption by eating more leafy green vegetables, and taking nutritional supplements. Researchers have linked eye-friendly nutrients such as lutein and zeaxanthin, vitamin C, vitamin E, and zinc to reducing the risk of certain eye diseases, including cataracts. That's interesting. For more information on that, please consult your eye doctor, and they can tell you more about that. So, I did have cataract surgery last year. I have what's called congenital cataracts, meaning I developed them when I was young, and they didn't become bad enough to remove until recent years. And they will grow back because they are congenital. So they're genetic. They did go in and take them out, the cataracts, and then they put in an intraocular lens. My eyes became clearer looking because the cloudiness was removed. But what was really nice is, before surgery, I couldn't tell the difference between black, navy blue, dark green, and dark brown. Post-op, I can tell the difference between those colors. So that's amazing. I really like that. And my glasses do have a purple tint to them. they have UV protectant on them, which is wonderful. They have UV protectant and blue light glare and all that on them. That's awesome. My glasses don't correct me to 20/20. That's impossible to do anymore. I do not have central vision anymore, but it's awesome that they're able to correct me to the cataract lenses are able to correct me to a certain degree. I see peripherally, I don't see with central vision. But cataract surgery was so easy. The longest thing I had to do was wait in pre-op, because they numb your eye and they put in dilating drops, and they keep doing that repeatedly over a couple of hours. At least it seemed like a couple of hours. It might not have been that long. And then surgery itself is like 15 minutes, and post-op is 10 minutes, and that's it. I mean, it took no time, and it was painless. Seriously, completely painless. You're awake, and they can talk to you, and all you see is a bright light shining in your eye. That's it. It's fantastic. Post-op, I had no pain. I had multiple drops to put in my eye for several weeks. That was great, and they did one eye first, and then they did the other eye a month later. It's fantastic. So I am really glad I had cataract surgery. It's great. My husband said it brightened up the color of my eyes. It was really funny when I had surgery in one eye, and then I had to wait for the other one, and he's like, wow, it really brightened up the color of your eyes. So waiting to get the other one, because then he could tell the difference between the two when only one eye was done. So that was neat. So if you are contemplating cataract surgery, have it done. It's well worth it. I'm so glad I got it done. I mean, really glad. I mean, wow. Super glad. So whenever it comes time to get it done again, I will have it done again, because it takes no time. It's well worth it. Absolutely worth it. The way it just clears up clouded vision is amazing. So, absolutely. In the meantime, please stay safe, be kind to one another, and as always, happy yarning. Bye now.